Hey guys, my name is Mammon, and today I'll be talking about a common sports injury, which is a dislocated patella. Let's get started. So what is a dislocated patella? Well, the patella is a triangular sesamoid bone. The patella rests in a groove on top of the femur called the trochlear groove. A patellar dislocation occurs when the patella jumps out of the trochlear groove so that the patella is completely displaced from its normal position. Patellar dislocations occur quite frequently, especially for young athletes. Most of the time, these dislocations occur laterally. What other parts of the body are affected when the patella dislocates? Well, along with the tibia and femur, the patella is one of the three bones that make up the knee joint. Several ligaments and tendons hold the patella in place and allow it to move up and down the trochlear groove when the leg bends. The quadriceps tendon attaches the top of the patella to the quadriceps muscle. The patellar tendon attaches the middle of the patella to the vastus medialis obliques and vastus lateralis muscles. And this tendon also attaches the bottom of the patella to the head of the tibia. The medial patellofemoral ligament is almost always torn when the patella dislocates. Also, the lateral collateral ligament and the medial collateral ligament stabilize the patella on both sides, and they can also sustain damage when the patella dislocates. A dislocated patella can be a result of both a contact or non-contact situation. Athletes can dislocate their patella when their knee is straight but their lower leg is bent outwards and they rapidly try to change their direction. This would be an example of how the patella can be dislocated in a non-contact situation. In addition to this, direct blows to the knee can also be a cause for patella dislocations. If the patella is hit while the knee is bent, this can lead to dislocation as well, since the patella can be knocked out of its joint. However, there are some factors that can make it more likely that you would dislocate your patella. For example, you're more likely to dislocate your patella if you have weak inner quadricep muscles, a history of patella dislocation or subluxation, or if you have a patellofemoral joint hyperlaxity. Some of the symptoms that come along with a dislocated patella include swelling, extreme pain until relocation occurs, continued pain along medial ligaments, tenderness around the patella area, feelings of instability, especially when performing activities that are weight-bearing, inability to bend or straighten the knee, and difficulties walking. So how is a dislocated patella diagnosed and treated? Well, a health professional can detect a dislocated patella based on both X-ray results and symptoms. Reduction is generally done by pushing the patella back towards the midline while straightening the knee. After reduction, usually the patient will receive a splint so that the leg is in a straight position when worn. The splint is usually worn for around 3 weeks. Surgery for a dislocated patella is extremely rare and uncommon, especially if it's only the first time dislocating the patella. But if this injury is extremely recurrent, surgery may be done. If this injury is extremely prevalent and recurrent, surgery may be done. There are a few complications that come along with dislocating the patella. If the dislocation was due to weak thigh muscles or a problem with the alignment or structure of the knee bones, the patella may dislocate again. Also, athletes often have a really hard time once they've sustained a patella dislocation. There will be increased residual instability around the kneecap, as well as residual weakness and balance as a result of this injury. Also, ligaments, tendons, muscles, and cartilage around the knee joint may stretch or tear permanently after the dislocation. Also, a piece of bone may be broken off somewhere in the knee joint as a result of the dislocation. Additionally, a dislocated patella can also lead to degenerative arthritis. It usually takes a patient around 6 weeks to fully recover from dislocating their patella, and around 3 of these weeks are usually spent wearing a splint in order to help with the recovery. However, it'll still take more time after the 6 weeks for the patient to return to sports, and usually physiotherapy is recommended in order to regain full mobility and strength. There are various physiotherapy exercises that are recommended to patients who have dislocated their patella. One of these exercises is a standing hamstring stretch. For this exercise, you'd put the leg you've injured on a stool about 15 inches high. You would keep your leg straight, lean forward, and bend at the hips until you'd feel a mild stretch in the back of your thigh. In order to do this exercise properly, it's important not to roll the shoulders or to bend at the waist. This stretching position should be held for 15 to 30 seconds. Another recommended physiotherapy exercise is a quad set. This exercise is done by sitting on the floor with your injured leg straight and your other leg bent. Then, You'd press the back of the knee of your injured leg against the floor by tightening the muscles on top of your thigh. This position should be held for 10 seconds, and it's best to do 2 sets of 15. Another exercise that physiotherapists might recommend is a straight leg raise. In order to do this, you lie on your back with your legs straight out in front of you. Then, you bend the knee on your uninjured side and place your foot flat on the floor. Then, tighten the thigh muscle on your injured leg and lift your leg about 8 inches off the floor. It's important to keep your leg straight and your thigh muscle tight. Then you slowly lower your leg back onto the floor and do 2 sets of 15. Another recommended exercise is a wall squat with a ball. To do this, you stand with your back, shoulders, and head against a wall, and it's important to keep looking straight ahead. Also, your shoulders should be relaxed and your feet should be around 90 centimeters from the wall and the shoulders width apart. Then, you'd place a soccer or basketball-sized ball behind your back. It's important to keep your back against the wall and slowly squat down to a 45-degree angle. This position should be held for around 10 seconds and then slowly slide back up the wall and repeat this 10 times. Thanks so much for watching my presentation. This is the end.